So as a prescribing supervisor of a student who's doing a prescribing practicum, you're going to need to spend some regular time with that student over the course of a year. The Nursing Council describes the type of time you spend with them as formal time or informal time, and they describe it as direct and indirect. So that means that there will be times when you're with a student at their elbow, and there will be times when they're at your elbow watching what you're doing. And then there'll be other times when you're talking with the student about their practice and the decisions that they made. And there'll be other times when that might take place, that conversation might take place just in the corridor. So case review is a really key part of that supervision, and so is informal conversations. Certainly what really needs to happen is there should be at least an hour a week where you and the student are reviewing cases that the students worked on that week, and talking through issues that maybe they're not sure about, and the decisions that they've made, and thinking about what other possibilities there were. What matters most is that you feel absolutely confident in this student's ability to make a safe decision, so that you're certain that when they're unsure, they'll get advice, and you're certain that they'll make sound decisions based on the assessment data that they've collected about the patient.
For the prescribing practicum, there's an extension into obviously prescribing, and that requires pharmacological, pharmacy, prescribing, drug interaction, all sorts of things actually start coming into it. So it is a specific area of practice. I think you need to have a very close supervision. Obviously they are not allowed to prescribe, so you're going to be checking all the prescriptions, but you make sure that if they are generating them, that the history, the examination, problems, management plan, prescribing does actually work. It's no good just saying, yes, this is okay, paracetamol. You've really got to check all those stages, otherwise they can potentially harm people quite easily, and this has to be a safe process for patients. But I don't think there's a magic switch where you go to nurse practitioner prescribing school and learn how to do it, and then you get pass on Friday and on Monday you start writing prescriptions. You've got to learn how to do all of that process through the whole year. And there's actually quite a lot. It always amazes me how much you actually have to learn to write a prescription. PMS systems produce them for you these days. Controlled drugs are a little bit more difficult, but just actually making sure they know the legalities and stuff around drug users, drug abuse, drugs of abuse, etc. It's a very big area, and sometimes that's not something they've come across in their training to date. So I think there's a much bigger safety angle there in the actual intern year, but also a safety angle that they have to be impressed with fundamentally moving forward if that's what they're going to do. It's actually making sure they've got the requisite skills and knowledge. They've actually got the ability to take histories, they've got the ability to do examination. They've got the ability to actually put that together as a problem list, a differential diagnosis, a management plan, and then for prescribing actually being able to prescribe. So it is actually breaking it down into all those chunks, and each candidate that I've had the pleasure of supervising has had strengths and weaknesses across that broad palette. And part of your job as a supervisor is to test out what those are, and some they've got it. In terms of how you actually do the supervision, I think again you've got different modalities that you can use. You can do straight out case review stuff, so let the candidate do something and then at a later time review their notes. You can work together with joint consultations. sitting in either way, them watching you, you watching them. You want to specifically check skill, and some of those things have to be on a one-to-one basis, so you can only check clinical skills by actually observing and being there in the room with the person, unless it's recorded somehow. But you can't do that at a distance, you can't do that later. You can sort out differential diagnosis and management plans and things, you can do that at a distant time. So some things do actually need to be sort of in the flow of work. And I think you get a very different perspective of what somebody's capabilities and potentially weaknesses are by actually watching them do it. Sometimes we have a insufficient and sometimes we have an inflated perspective of how good we are about doing something, and that's, you know, positive or negative, and you only get that by actually watching the person in real time. So it is a balance of both, and I think supervisors and candidates will have a preference for how they actually interact.
So if you're writing a reference for the student for when they apply to the Nursing Council for registration, what the council need to see is your confidence in the student's prescribing ability. So if you look at the prescribing competencies and write something in relation to each of those items, then the council can be assured that this person is going to be safe to prescribe in the future. Mistakes are inevitable and everybody needs to learn from them, including students and including the most experienced of practitioner. They need to learn from their mistakes too. So it's about talking it through and figuring out a way forward for the patient, if that's what needs to happen, and also to make sure it doesn't happen again.
I think that comes back to the collegiality. So while my job's to challenge and cajole and coax and do all sorts of things through the year, I get that back in spades. So a good nurse practitioner candidate, and they are all good candidates, will challenge me back and ask me, challenge my practice. I found they've got a very nasty habit of coming back to me with evidence that challenges my viewpoint, which is great, but you have to be open to that.